Welcome to the Principles for Parents website. I'm Dr. Peter Hanfileti. I'm a pediatrician, a medical acupuncturist, a body talk practitioner, and a holistic physician with my own practice and clinic called Points of Origin in Vancouver, Washington. My conventional training in medicine includes the following. I graduated from Earlham College in 1987 with a bachelor's degree in biology. I then went on to medical school at the State University of New York at Buffalo, where I completed my studies and received my MD in 1991. My internship and residency training in pediatrics took place at the University of Michigan's C.S. Mott Children's Hospital in Ann Arbor, Michigan. I completed this training in 1994 and then moved to the Pacific Northwest. My wife Lisa and I settled in Vancouver, Washington, where I worked as a board-certified pediatrician from 1994 to 2000. Starting in the late 1990s, I became interested in Chinese medicine because my wife Lisa became a patient of acupuncture and experienced great success. She then decided to go to the Oregon College of Oriental Medicine's 3-year program, and she became an acupuncturist. I pursued training in medical acupuncture through the UCLA program designed for physicians. I also studied with other teachers and learned other alternative medicine modalities in the ensuing few years. In the year 2000, we opened our own practice called Points of Origin. I subsequently learned about the body talk system, and I became a certified practitioner of body talk. I now use these modalities in my practice, along with several other techniques, and I enjoy seeing patients of all age groups. My philosophy on medicine and life has changed throughout the past several years. I used to think and believe only in the conventional way of doing things, whether in medicine or other topics. Now I have a greater appreciation for the need to integrate many diverse fields together in order to more closely describe what's really going on in our lives and in the world. I will try to share some of these insights in the pages of this website, but mostly I will try to convey the best information I can on the topic of energy medicine and how it relates to you and your kids. One of my most important operating assumptions is that your child is unique in all the world. I used to have trouble reconciling this with what our current conventional medical system tries to do when it comes to categorizing people. In recent years, however, I have arrived at the conclusion that any labeling or categorizing that we do as physicians quickly loses its utility when you take into account the unique experiences, family histories, environmental situations, and many other variables that quite simply trump any diagnosis or medical jargon used to describe your child. The blunt way to put this is to say, your child is not a robot. Your child should not be compared to anyone else, even other direct family members or siblings, and your child uses energy medicine principles and techniques on a daily basis, whether we realize it or not, and they are affected by energy influences all the time. I feel I can give you a new and perhaps different perspective on your child than you may have heard of or been aware of up until now. I am committed to giving you more holistic information so that you can make the most informed decisions possible for you and your child. I believe you need more than just 1 or 2 options to choose from. The more options you have, the more likely you will find what works best for your child. My opinion is that a balanced approach is better than one or the other. I'm talking specifically about choosing between conventional versus alternative methods. I like the term complementary or integrative much better than alternative, because this describes adding to rather than taking away from. Finally, I think families need encouragement and support. The solutions for your child will always be group solutions for your family as a whole, not just an individual. This is the reason education is such an important part of all natural medicine strategies. My perspectives come from my experience in both the conventional pediatrics world and the realm of alternative medicine. I believe we must be open to using both, as this allows us to cover the most territory and fill in the most gaps in our understanding. Not all medicine is contained in textbooks. I have learned this firsthand. I also have a pretty strong perspective on how your view and feelings regarding your child have a significant effect on them. We have to realize that energetic influences are always taking place, regardless of whether we are consciously aware of them or not. This takes some getting used to, but I have found it to be invaluable as a way to more accurately understand what is going on with your child. In this current day and age, you need more than pat answers. To me, holistic means all-encompassing and not shying away from purely energetic explanations. This is one of the points of focus in my conversations with parents in my office. Holistic implies individually treating your child's unique system. I believe it is no longer adequate to just address the age-appropriate milestones, the likely symptoms your child will have, and to treat infections with occasional antibiotics. This is more difficult and time-consuming, but necessary if we do not address the past historical settings, the energetic impacts of your child's current situation, and the future predispositions he or she may have. Then we are only prolonging and in many cases making it harder on your child. When it comes to choosing the right pathway for your child, you need options to choose from, not pigeonholes to squeeze your child through. Since you are traveling along with your child for the first 15 to 20 years of their lives, you must help them navigate their way along this path. Your choices need to be right for you and your child, not somebody else. The energy explanation for why this is true is the following. Your child is aware and affected by your energy dynamics, period. In today's complex and stressful world, you need a balanced approach to the healthcare needs of your child. In my opinion, there are numerous instances where the medical and surgical approach is inadequate or inappropriate. On the other hand, there are times when prescriptions or surgical procedures are necessary. If you are looking for something different yet balanced, I know you'll find it here on Principles for Parents. I see my role as an adjunct or as an additional contributor to your knowledge base. It is also clear to me that most parents in today's world need some form of encouragement and support that is not readily available in a 15-minute appointment. Even in my own practice, 1 hour is often not sufficient to address all concerns that come up. Using the online environment is a way to partially overcome this challenge, although it is not a substitute for a one-on-one consultation with your doctor. My goal is to make Principles for Parents a valuable and solutions-oriented website for you to explore and learn from. I want to point out a few specifics about the website itself. Use the navigation bar on the left-hand side of each page to click to other pages on the site. Make sure you sign up to receive free downloads like ebooks and videos in the right-hand margin of most pages. Be sure to visit the blog, which has other articles and links on it, which will be of interest to you. Finally, use the contact form or email me at drpete@principlesforparents.com if you have any questions or comments. That's DRPETE at principlesforparents.com. In the last few years, it has been very gratifying for me to see more and more parents who are looking for alternatives for their kids' healthcare needs. I think we as physicians can do much better when it comes to offering these alternatives, and therefore that is the reason I started developing this website. I believe the more information you have to work with, the better off you and your children will be. The world of alternative medicine promises to be new and exciting in the coming months and years. I have already experienced many new things I never even thought of before. Hang on for the ride! These are my other sites listed here. I'm Dr. Peter Hanfileti, and I thank you for visiting with me.